Well, thank you for joining me. My name is David Kading, and we're excited to have you being part of the American Academy of Optometry Foundation clinical podcast series. I am excited to be joined by the brilliant Dr. Karen Lee. Thank you for joining us. Please tell us a little bit about yourself.
Yeah, so I thank you for having me, first of all, Dave. It's always a pleasure to hang out with you and get to talk with you.
Yeah.
Hopefully we can do this in person soon. I'm a Hoosier IU grad, optometry school wise. I went to cornea and contact lens residency at SCCO in Fullerton, Anaheim. And then after that, I actually worked at UCSF for 3 years as their pros provider and at the University of Houston College of Optometry for 6 years. And then recently, Tarsus came and swooped me up. So I joined industry for the last 9 months as their senior medical ambassador. And my territory really is in the Texas, New Mexico, and Louisiana region. And so I'm really excited about these articles today. They are what I've been living and eating and breathing for the last 9 months.
Yeah, absolutely. You have really been digging into this. I know throughout your entire career, but now especially somewhat recently. So let's dive right in. We're going to be talking about a paper about Demodex, and I'll be quite frank with you. Demodex came up a couple of years ago, and then it kind of went away for a while, and then it came back up. And I kind of had to ask this question, like, is this really affecting patients' quality of life, their daily life? Is it something that is even happening to us on a regular basis? Tell us a little bit about this paper and why you think it's kind of important. Just give us a quick little overview.
So I love this paper, The Impact of DB on Patient Symptoms and Daily Life, because it really highlights the burden and impact that DB patients have and when they struggle with this ocular inflammatory condition, right? So to the ECPs out there, a lot of docs might say that this is not something they see, it's not a common condition. Well, I really hope that when you read through this paper, it kind of makes you pause for a second and just take an extra few seconds behind the slit lamp to ask your patient to look down and look for those pathognomonic collarettes, because this disease is a condition that truly does not discriminate when it comes to age, gender, ethnicity. You can have DB at any state and any point. And there have been studies that have found that DB affects around 58% of patients presenting for eye care. And when you think about 58% of patients presenting for eye care, that's around 25 million US eye care patients, or 1 out of every 12 adults that are being impacted. So really,
So, so how is Demodex blepharitis different than regular blepharitis?
yeah, so Demodex blepharitis is caused by Demodex mites. We have two different types of species on our bodies, Demodex folliculorum, which lives within the lash follicle, and Demodex brevis, which resides within the sebaceous glands and the meibomian glands. And for some reason, we don't know why, in some patients, you tend to have an overgrowth of these mites. And once you have that overgrowth, then we say you have full-blown DB. Or Demodex blepharitis. And based on our Titan studies, we have found that Demodex blepharitis is actually one of the leading causes of blepharitis. So
Mm.
amongst the patients that were diagnosed with blepharitis, 69% of them actually had Demodex blepharitis, to give you an idea.
Yeah. So this particular paper here, they brought up something that I hadn't ever heard of, and that is the BLISS questionnaire, because we're digging into symptoms here, and
Mhm.
that stands for blepharitis symptoms questionnaire. I like the acronym blepharitis symptoms questionnaire. What was kind of noted here with regards to 58% of our patients coming in? What are some of the questionnaires telling us that they might be experiencing?
So this is actually a questionnaire that we can't take credit for. This was published in 2018. They looked at 13 specific symptoms that blepharitis patients tended to complain of by looking back in literature at case reports and other publications and whatnot. And again, those 13 symptoms were just general blepharitis patients. They didn't really differentiate between DB or bleph. And in this paper, our survey is a little bit different in that it's just based off of the BLISS questionnaire. And so instead of asking about 13 symptoms, we ask about 15. But the most common ones that your patients will complain about are eyes that itch, dry eyes, foreign body sensation, and irritated eyes, to give you an idea. And those are just
Hmm.
basic things we hear every day in clinic. You probably heard that like 15 times today, right, Dave?
Yeah, yeah. Well, yeah. So the thing is, like, how does this fit in with the dry ice? I was kind of ask you, why is it oftentimes misdiagnosed as dry eye? And I presume from a symptomatic standpoint, because very common symptoms
Mhm.
that patients with blepharitis, Demodex blepharitis have this dry eye. Is that correct?
Yeah, so there's a lot of overlap between the symptoms. And so that's why we have oftentimes misdiagnosed or underdiagnosed patients with DB, because they just present with ocular irritation or injection. And with these common complaints that I just mentioned, we think back in school, we're taught think horses, not zebras, right? So we tend to hear those chief complaints, and we're going to put those patients into those really common buckets of dry eye or allergies, and DB might not really come to mind just based off of how we were educated in the past.
Yeah. Yeah. So to give some background, the study it looked at 1,500 patients, 1,558 patients over 20 different sites.
Mhm.
And they found that 524 of the subjects met the criteria that have having Demodex blepharitis. And what was kind of interesting in here is less than 1% of them were asymptomatic. And I think it was 98% of them were symptomatic for two different things, two or more symptoms. So this isn't something like it's a mild irritant. It's something that kind of is affecting people, somewhat substantially in this dry eye arena, which is no wonder it's either misdiagnosed as dry eye or not detected as being something really substantial. You have thoughts on that?
So I would say, because I think a lot of doctors will say these patients come in and we ask them, how are you doing? What are you here for? And they say they're fine, or I'm just here to update my glasses. And maybe there's a lack of understanding about their condition. And I think a
Yeah.
lot of people maybe get so used to these symptoms that we chalk it up to other things like aging or those other conditions that we hear so commonly. One thing I want to hit home in this paper is this is not a acute short-term symptom
Right.
either. More than two-thirds of the patients have been having symptoms for 2 or more years, and 46% of subjects actually had symptoms for 4 or more years. And these patients aren't just sitting around not, doing something about it. 77% of these patients say that it does affect them negatively in their daily life. So they're coming to their optometrists, ophthalmologists, and primary care providers to seek some sort of treatment.
Yeah. Yeah. I say you see here in the study, 20% of the patients went to their doctor 4 times for this. And
Mhm.
so, probably wasn't getting the treatment or the help that they were looking for. So, what does the life of a Demodex patient look like? In this study, they looked at, symptoms, driving, other sorts of things. Like, what are some things that you kind of noted in here that, even as a clinician who's seen patients for years like you have, some of these really blew my mind. What were some of them that, like, for you, even was a shocker?
So I was really surprised by how many of them. I think the most common um, way that they were affected negatively was like poor nighttime vision, or they had a hard time driving at night, because
Hmm.
a lot of times we would think cataracts or just dry eye. And I'm like, okay, maybe this is something I need to look for in my DB patients also. And I just the sheer number of patients that come in and the number of times they come in. And I was kind of disappointed in myself because I was like, wow, how was I missing so many of these patients when they've been having symptoms for so long? Maybe I need to change the way I take my case history. Maybe I need to, ask more specific questions to try to solicit a response that makes me think of other things.
Yeah, well, I know near and dear to your heart and my heart, being contact lens nerds, is, the ocular surface for contact lens wearers. We know the ocular surface is obviously affected with all the symptoms these patients are having.
Mhm.
Anything in the study really speaking towards contact lens wearers that stood out to you?
Yes. So we kind of mentioned that there was a really large cohort of patients within this study itself. And when they broke down the patients that wore contact lenses, they said 64% of the contact lens wearing patients in this study reported contact lens intolerance or fluctuating vision. 64% sounds like a lot, but then when you actually look at the number of patients that were actually wore contacts in this study, it was actually quite low. I think it was what, 16 or 14 patients actually wore contact
Mm-hmm.
lenses. And so it kind of makes you
Mm.
wonder because, you know, you and I fit contacts so regularly all the time. You're like, where are all the contact lens wearers in this cohort? And then if you do a deeper dive into the literature, you find that there are other publications out there that report, you know, a much higher or stronger association between DB and contact lens intolerance and contact lens dropout. And so one thing I wish we had in this paper was a little information about the history of their contact lens wear, like how many of these
Yeah.
patients tried contacts in the past. And
Used to wear them. Yeah. I think, put another way, 93% of the patients of contact lens intolerant patients were positive for Demodex in here. So there was a huge intolerance. And although only 14 subjects in the study of what was it, 540, did I say earlier?
Mhm.
That proportion of contact lens wearers to patients in the studies is astronomically low, and
Yeah.
it just makes you wonder what the hey. And if like you said, if we could have asked that question, is did you used to wear contact lenses, it'd be really curious. We're all speculating here. We don't know what the study all looked like, so I don't want to dive too much into that. This is a really fascinating thing, and there's a lot of really interesting things in this study, but for the sake of time, anything else stand out to you that you want to touch on in closing?
You know, honestly, I think what I find really encouraging about this paper and that I'm
Yeah.
hopeful anytime we have data like this, I really just hope that ECPs will look at this data and really utilize the information to gain a better understanding of just how burdensome this condition is. And I hope that it encourages them to, again, take a little more time to look for those pathognomonic collarettes, ask specific symptoms, and start educating their patients when they see this problem.
Yeah, those symptoms, I just associated my dry eye evaluation. I'm not digging it down. So this is definitely really informative. I love this paper in that way. I'd encourage you all to go out and read it and check it out. Dr. Karen Lee, thank you for hanging out with us and educating us on Demodex. What I love about it is your scientific perspective. Although you're now in industry, you look at this as a clinician, which I really, really love. So thank you for bringing insights into this paper for us.
Thank you so much. Have a good day, everybody. Thank you.
Yes, and thank you for joining us for the American Academy of Optometry Foundation clinical podcast series. Make sure to stay tuned for future episodes. See you then. Good. Let's clap our hands, wave our